Hi everyone, we are Group 5. Our topic is Career Adventure Mind. Hi, I'm Lily. Today I'm going to tell a story about how I went from an ordinary girl to a professional respiratory therapist. When I was little, I didn't have any big dreams. Until one day, I saw someone on TV being saved from illness, and the moment something changed in me. I wanted to become a medical professional too, to become someone who helped others. At 18, I made my first important life decision. I chose the Department of Respiratory Therapy at Fudan University.
This path won't be easy. In college, I will have to face many challenges. There are many professional fields to learn. First, anatomy, to master the structures of the respiratory system and the mechanics of respiratory muscles. Second, physiology, to understand the mechanics of gas exchange and how the brain regulates respiratory rhythm. Third, biochemistry, to comprehend acid-base balance in the blood, which is essential for interpreting arterial blood gas reports, and others, all kinds of medical knowledge. Breathing is more than just inhaling and exhaling. Pressure, the diaphragm and intercostal muscles contract to create pressure. Gas exchange, oxygen diffusing in the alveoli. Blood balance, oxygen and carbon dioxide staying in balance in the blood. My senior year had arrived. I stepped into the hospital for my clinical internship.
During my clinical internship, I developed a variety of professional skills. I learned to monitor patient respiratory status, auscultating lung sounds, and document their conditions and responses to treatment. I also performed oxygen therapy, including administering oxygen, adjusting flow rates, and monitoring for hypoxia. In addition, I gained experience in mechanical ventilation, such as adjusting ventilator settings, assisting with intubation and weaning, and observing patient ventilator synchrony. I also followed the physician's order to administer medications and perform nebulizer therapy, followed physician's orders to conduct arterial blood gas analysis, and learned basic airway management, including suctioning and tracheostomy care. However, the internship also came with significant stress. In the clinical setting, I often feared that mistakes could affect patients' lives, especially in the ICU, where quick and accurate decisions are required. I also experienced anxiety due to the gap between theoretical knowledge and real clinical practice. Moreover, I faced pressures from time constraints, physical fatigue, and communication challenges. Emotional stress was especially difficult when dealing with patient deterioration or death. After the internship, I began preparing for respiratory therapist licensure examination. This required integrating knowledge from multiple disciplines and applying it to clinical scenarios. With long hours of studying and limited social life, the psychological pressure and anxiety became intense. At times, I even doubted myself. Fortunately, my hard work paid off. I successfully passed the licensure examination and became a respiratory therapist.
In the hospital setting, I rotate across various clinical units. Our duties range from managing medical ventilators in the ICU and providing routine care in respiratory care ward to performing diagnostic tests in PFT labs and responding to trauma in the emergency room. Our core responsibility encompasses medical ventilation, oxygen therapy, airway management, and emergency resuscitation. However, the role is not without its challenges. As core member of the Code Blue team, we must make life-saving decisions in a matter of seconds. The job is physically demanding, involving rotating shifts and the handling of heavy equipment, all while navigating frequent exposure to infectious disease. To excel in this field requires more than just technical skill. It takes a client mind and clear communication. In the end, our ability to support patients and their family through their most difficult moment comes down to our empathy and patience.
Switch to long-term care institution. In long-term care, artists manage ventilators and access weaning. We perform suctioning and chest physiotherapy to clear airway and prevent pneumonia. while using pulmonary rehab to strengthen lung function and improve quality of life. Beyond hospital, home care is not just about providing treatment, but about delivering hope. Success requires solid professional knowledge and communication skills. I go into patients' homes to protect their health and every breath they take. I also yearn for deeper professional challenges. These paths require advanced certifications and clinical skills to handle complex cases. It all comes down to accumulating experience over time. For me, every step is about providing more precise and compassionate life support to my patients. I can also apply my expertise to the business world, particularly to medical device companies. My role will shift to that of a consultant, a bridge connecting technology and products. I will guide medical professionals in using cutting-edge equipment to improve efficiency from bedside care to the rollout of high technology.
Continuous learning is key to maintaining professional excellence. Therefore, I can choose to pursue further studies in the future. I know that the knowledge accumulated through further education will allow me to see further and work more steadily. Although this career path is long, I'm ready to embark on it. Every step on the path of a respiratory therapist will be very meaningful.